22 minutes to 9. We're talking about chronic pain now, a debilitating condition. It affects 14 million people in England alone. Scientists, though, think that they've come a step closer to understanding it. They've studied people who don't feel pain at all.
Yeah, BBC Breakfast has learnt that University of Cambridge researchers have identified a faulty gene that seems to switch pain off in some people, and now it's hoped that the discovery in them could lead to new treatments for those people who live with pain every single day.
Let's talk to Dr. Adam Al-Kashi from the charity BackCare and Pete Moore, who does suffer from chronic pain. Good morning to you both.
Morning, morning.
Pete, shall we clarify the term chronic pain? We spoke to you a little bit earlier, because you don't refer to it as chronic, do you?
People with pain, I don't even refer to us as actually patients. We're people with pain. And I think we prefer the term persistent pain rather than chronic pain. Chronic pain to us means never-ending, life-threatening. It's never going to end. But I live with persistent pain. I still have it now, but what I like to think about it, I self-manage my pain, and I think of it like the volume knob on a radio. I just do stretching, exercising, pacing and stuff like that, working with healthcare teams, stuff like that, to turn the volume knob down so my life is more manageable.
I want to talk to you in a minute about your tips for people, because I know you think that you've got methods that might help people, but at its worst, your back pain at its most persistent. Can you put into words what it was like? What the kind of things that people who have pain are living with?
I suppose the best way to describe it really, back in 93 actually, the New Year's night. It's my birthday actually, the New Year's Eve, and that night I was some friends come around to take me out for my birthday, and if you had said to me how big's your pain today from 1 to 10, I would have said 100, and I said I couldn't go out, and I was so down and depressed. I'll be honest with you, I did think about harming myself. Like, I thought, what's the point in going on? I was only in my late 30s then. But I did a little bit of stretching, I thought, and it sort of eased off a bit. It came back with vengeance the next day. But I think that was I suppose what they call a rock bottom. And I think, well, I need to take some action here. And that's what I did. I went on a pain management programme at St Thomas's in London in '96. And they gave me the confidence skills to actually manage my pain myself.
Adam, we're going to look at or examine some of the techniques that are possible, but when we go back to this research now, so many people who are living with persistent or chronic pain, however you like to refer to it, will be looking for some hope and maybe have the same idea at some point. What's the point? I can't bear living my life if it's going to involve being in this much pain for the rest of it. How have you dealt with, or how are doctors dealing with patients with chronic pain? What mindset, how do you approach it?
Absolutely. Well, I think it's really important that, yes, we should always stay open to discovery, and I'm not saying that, we won't in the future find, more effective medications than we have today. I hope we do, because the medications today aren't very good long term. But at the same time, when we look at the clinical research that we have now, and that's what we really have to act on, we know that if you want to get a better handle on your chronic pain or your persistent pain or recurrent or long-term pain, you have to transition from the passive treatment mindset to the management mindset, which means we have to stop searching for the magic drug or the surgical solution or the thing that's going to be done to us to fix us, and transition into this idea of taking responsibility and really getting a handle on all the factors that feed into pain. And one of the biggest upgrades that you'll find in the pain toolkit and the work that Pete does is to start including fitness and well-being. And we all know the terms health and fitness and health and well-being, but what is health without fitness, and what is health without well-being? And when you actually include well-being and fitness in health, you get a very, very different effect.
We're just looking at some emails. Many people have written in, John.
Yeah, lots of people talking about chronic pain and what it does for them. Alison's 49. Morning, Alison. She says she's suffered with chronic pain most of her adult life. She's had 2 back operations. There's not a day that goes by when I'm not in pain. Derek, too. After an operation, I've lived with pain. I'm happy I'm still alive, but he just wants some kind of solution.
And also, they're talking about painkillers as well. Jackie says she has pain in her back, hips, knees and ankles. It limits what work she can do. Obviously, keeps her awake at night. She has to take 2 different types of painkillers on a daily basis. It's very easy for anyone who's not in persistent pain or chronic pain to say you need to manage it without the meds. But there's instant relief that's often needed. It's interesting for both of your views. People need a solution quickly, don't they? Because it gets you down.
Medication's okay short term, but long term, because we've got to remember you're taking things inside your body. That young lady there what she said, 49.
49.
49. I mean,
Alison, yeah.
you know, the lady said to live older than us guys. I mean, she's probably got another 30, 40 years in front of her, but she can't keep taking the same quantities of medication.
Pain medication becomes less and less effective the longer you take it. And we're not talking about stopping your medication. We're talking about start with pain management techniques, and you will naturally find that your need for medication diminishes. And many people are medication-free who do good self-management.
Okay, gentlemen, thank you both very much indeed. I hope you continue to beat it and feel better. Thanks very much indeed. Cheers.
Thank you.
Thank you.